Good evening, everyone. We are from Group 8. We will be presenting our assessment about Ferrari pit stop crew and paramedic crew on the fire department. Before start our presentation, we'll introduce ourselves.
My name is Rosalia Kartikadewi.
My name is Valentino Gibrjayadi.
And my name is Farja Safa Adistia. This is our presentation outline. The first one is introduction of group members. Number 2 is situation. Number three refer situation. Number 4 similarity and difference table. Number 5 production planning and control. Number 6 discussion and conclusion. Background: a fire broke in an apartment building. Ambulance deposit victims suffering from broken bones from falling, burn injuries, or problem with breathing. The location is in an apartment building. Cause of fire: it could be anything from electrical malfunction. Ambulance handoff is what should ambulance crew do when they are arrived at the location. The first one is initial assessment. Initial assessment is the crew will quickly identify and evaluate victims in need of medical attention. The second one is pre-hospital care. If the victim has burn, so the ambulance crew need to cooling burns with the water for a short period. And if they have a serious burn, they might prioritize covering the burns area with sterile sheet and preventing further contamination. The second one is smoke inhalation. They could give the victim oxygen therapy through a mask to increase oxygen level in the blood. And then they need to positioning the patient in a way that optimize breathing. The third one is broken bones. They need to suspect fracture with the spleen to minimize pain and prevent further movement. The last one is other injuries. They need to providing first aid for any other injuries identification. The third one is patient transport. After they give the initial assessment and pre-hospital care, and then patient will be carefully transferred to the ambulance to transport to the hospital. In ambulance, there are equipment for continued care during transport with stretchers, oxygen supplies, and medication. The last one is pre-arrival communication. Pre-arrival communication, the crew will call the hospital emergency department to inform them of the incoming patient and their condition. Then, emergency department staff is prepared to receive and treat the victims immediately upon the arrival.
Next are the SOP on hospital handoff. The first step is receive the information. So the patient information from the ambulance will be transferred to the hospital via the radio. The information such as the medical history and the diagnosis for the patient. So the next step is waiting and preparing the equipment and the treatment. After receiving the information from the ambulance, the emergency department on the hospital will prepare the equipment and the treatment for the patient injuries such as broken bones and the burns. They also waiting for the patient to arrive. So the third step is moving patient to the emergency room. So when the ambulance arrives, the emergency department immediately takes the patient to the emergency room. So the last step is treat the patient. In the emergency room, patient wounds and injuries will be treated. Okay, the next discussion is similarities and differences between Formula One pit stop and the paramedic crew. Okay, the first aspect that we discuss is staff involved and the task distribution. So there are similarities between these two jobs, which is each staff or each worker has their own job. But also there is the differences between these two jobs, which is at the Formula One pit stop, there is a lot of people. Like there's a lot of people that checking the car up or maybe carrying the wheel gun, picking up and installing the tires, carrying signs, maintaining the stability of the car while pitted, and the most important is the race engineer. But in the paramedic crew, there are also a lot of crew that involved, but all less than Formula One. The staff that involved is the ambulance crew, including the driver and the EMTs, doctor, emergency department, nurse, and other medical staff. The second aspect that we discuss is communication. There are similarities between these two jobs, which is the requirement of good, clear, accurate, and the fast communication device, so they can work well to achieve their customer satisfaction. So both of these jobs use two-way radio system to communicate. In the case of Formula One, they communicate using two-way radio, which is connected to the race car driver, team principal, pit crew, and also the race engineer. When the team want to make a pit stop, race engineer will provide information to the pit crew and also to the race car driver. In the case of the hospital or the paramedic crew, ambulances also communicate with the hospital using two-way radio system. Also, when a patient on the ambulance, the AMT officer will provide or communicate with the hospital using radio for essential information such as patient information, conditions, also the location. So the third aspect that we discuss is handover coordination. On the Ferrari pit stop, the coordination carried out when making a pit stop is that like race engineer will communicate with the pit crew to prepare the tools and the tires to make a pit stop. And then he tells the racing driver to go to the pit. The comment that he used is like box to tell the driver to go into the pit. However, on the paramedic crew, handover coordination is carried out by notifying the destination hospital that a patient will be transferred for an emergency due to fall, burns, and difficulty of breathing. This coordination is carried out so that the emergency department has prepared the equipment, also and the treatment for emergency patients.
This is the tools that the ambulance crew needs for the victims. The first one is stretchers, number 2 is cervical collar, number 3 oxygen, number 4 medication and medical supplies for burn and smoke inhalation. The stretcher is using for transporting patients to the inside of the ambulance. And then cervical collars, it used for neck stabilization if there any patient with neck injury. And then oxygen tanks for respiratory support. And then medication and medical supplies for burn, smoke inhalation, and potential fracture. And then we are going to hazard and risk faced by ambulance crew when responding to victims suffering from broken bones, burn injury, and problem with breathing. First one is traffic condition. Ambulance crew need to navigate traffic while ensuring space and rapid transport to the hospital. The second one is weather condition. The third one is communication breakdown, such as miscommunication. Communication between ambulance crew, dispatch center, and hospital staff can lead to delay in treatment of misunderstanding about patient care. And the last one is fatigue. Because of the working long hour and managing multiple emergency can lead to the fatigue.
Let's begin with the most crucial element, the service user. In a Ferrari pit stop, the car itself is the patient. It needs a quick and accurate assessment to optimize performance. Similarly, for ambulance crew, the service user is the patient requiring medical attention. Now let's look at the assessment phase. The Ferrari pit crew are like expert mechanics. They swiftly assess the car needs, like tire wear, fuel level, and any potential damage to determine the best course of action. This mirrors the work of paramedics who rapidly assess the patient condition. They need to identify the nature of the emergency, whether it's a heart attack, a broken bone, or a difficulty breathing. Every assessment paves the way for the next crucial step. Based on their assessment, the Ferrari pit crew transform into a well-oiled machine. They recommend and perform necessary, like changing tires, refueling, or fixing minor damage. That's all aimed at optimizing the car's performance for the remaining race. This parallels the action of paramedics, who, after assessing the patient, and then recommend the most appropriate treatment plan. This might involve transporting the patient to a hospital for advanced care, or providing immediate medical attention on site.
So the next one is production planning and control. The first one is customer satisfaction, which is both jobs must do their jobs quickly, correctly for customer satisfaction. So on the case on Ferrari pit stop, every worker must do their job quickly and correctly according to their respective job description. Because in every race or every Formula One race, every second in the pit stop has a lot of impact on the victory. So when the teams win, the team will be satisfied. For the ambulance, arriving at the emergency location quickly, communication and the coordination with the destination hospital and the technology of the equipment can make a significant difference in the patient outcomes.
The second one is improve labor efficiency, streamlining workflow and process such as standardized protocol. Standardized protocol is implement protocol for common procedures like patient assessment, treatment protocols, and reporting. The second one is digital tools. They utilize electronic patient record for efficient documentation, communication with hospital, and access to patient medical history while on scene. The third one is dispatch optimization. This is consider factor like crew location, patient needs, and traffic condition to optimize allocation and minimize time.
The third one is about facilitated quality improvement. To truly hone their skill, but Ferrari pit crew and ambulance team benefit from simulated emergencies or pit stop. The simulation replicated the pressure of real-world situation, allowing them to practice clear communication, teamwork, and decisive action. And the last one is provide a better work environment. Recognizing and rewarding both individual and team achievement is a crucial for both Ferrari pit crews and ambulance paramedics. Just like a perfectly executed pit stop or successful emergency response, celebrating these wins motivated team members that strengthen morale and fosters a sense of job satisfaction. Fast-paced environment like Ferrari pit stop and ambulance handoff share a core emphasis on clear communication, effective and efficient teamwork, and adapting to unexpected situations. Despite their differing goals, saving life versus optimizing race car performance, both rely on highly trained specialists working in perfect synchronization. While the ambulance crew riding a wider range of emergencies and personnel compared to the control pit stop environment, both face challenges like weather and unforeseen circumstances. Ultimately, this parallel showcase the remarkable power of well-coordinated teams in achieving the result under the pressure. That's all presentation from us. Thank you for enjoying the video.